Exercise caution when considering external Hexagon Connection Systems, especially in cases of functional overloads like bruxism and clenching. The prognosis for implant-abutment screw joint stability in such cases is highly vulnerable to the abutment screw preload maintenance, leading to an increased risk of abutment screw loosening. To mitigate abutment screw loosening, consider making occlusal adjustments. This includes narrowing the occlusal table, flattening cuspal inclination, and aligning the occlusal contact with the implant location. These adjustments reduce lateral forces, consequently decreasing the likelihood of abutment screw loosening. Conical implant-abutment connection mechanisms serve as both an anti-rotational device during functional loading and positional stabilizers. These design features contribute to a reduction in abutment screw loosening. In the event of an abutment screw fracture, gold screws are generally more easily retrievable compared to titanium screws. This consideration should guide your choice of abutment screw material. Gold abutment screws offer distinct advantages due to their ability to secure a preload of more than twice that is achievable with a titanium alloy screw. This significantly minimizes the risk of abutment screw loosening and fracture. Clinicians should insist that their implant manufacturers provide essential information about abutment screws. This information should encompass details such as the chemical composition, tensile strength, coefficient of friction, and most importantly, the achievable preload at specific torque values. For example, 500 newtons at 30 newton centimeters of torque. This data has significant implications for both biologic and performance aspects. In a clinical setting, it is paramount to retighten a freshly placed abutment screw. This should be done either within a few seconds, immediately after fitting it, a few minutes later, or the following day, depending on the workflow and the practical considerations. These clinical recommendations aim to enhance the stability and longevity of implant systems by addressing factors related to abutment screw loosening and fracture. Thank you for your time listening to what I've shared. It's crucial that we support one another, exchanging information to leave a positive impact on this world. If you have a specific topic in implantology that you would like me to discuss, please feel free to reach out. If you find our content valuable, please consider liking and subscribing to help us grow this educational platform. Remember that the road to good health is paved with evidence-based scientific research, and keep smiling.